welcome to 72 Dragons Health. Today, we had the pleasure of speaking with Dr. Patricia Canessa. Dr. Patricia Canessa has dedicated her career to advancing health equity and improving public health. With a wealth of experience in leadership roles, including serving as a chair of the Health Equity and Social Justice Committee at the American Public Health Association, and as the Associate Director of Health Equity at the Illinois Public Health Association, Dr. Patricia Canessa has led transformative initiatives to address health disparities and foster inclusion. She's also the Executive Director of the Salud Latina initiative. Dr. Patricia Canessa has been a member of the Men's Health Caucus of the American Public Health Association. Welcome to this interview, Dr. Patricia Canessa. We're happy to have you with us today.
Thank you very much for this opportunity to have a conversation regarding health equity and certainly to highlight the work of the American Public Health Association in leading our work in public health, not only in the United States, but in many areas of the world.
Thank you. Patricia, what were the challenges and accomplishments that you attained through your appointment in the two leading health equity positions you have held as chair of the Health Equity Committee and as Associate Director of Health Equity at the Illinois Public Health Association?
Well, health equity is a relatively young term in the discussion of public health issues, as well as today many issues that range from having homeless still suffering from the deprivation of a safe opportunity, as well as violence. So today we are still growing in that concept and learning a little bit more about that. Part of the conversation with our committee during my 3-year tenure in reality was exactly finding out a definition and a work plan in order to assess and to enter into the so many disparities that we have. To do that, we had 2 mandates. One of them certainly was to conduct every other year an assessment within the APHA, the American Public Health Association membership, regarding these topics of health equity and how different were the roles, perceptions, and the engagement of the organization. And although the first year we certainly approached it with selected groups, by the second year, we were able to really engage more than 1,000 members of the American Public Health Association to give us a very wide opinions regarding where we are in the development of health equity within our own norms, as well as where is the functioning that public health professionals have in the United States. Learning about those gaps led us into recommendations to the council, and certainly those recommendations were followed up, and still we have a plan in which the organization is looking into how to improve and attract more professionals into this forum of discussion that enriches very much our interventions, especially at the time in which we have had the epidemics and we have an increase also of chronic disease prevention and education and interventions with our communities. Our second mandate in reality is to have a forum every year, an invited session in our meeting that is going to reflect a major influence in the public health professionals, and is going to give them another view, another vision of where they can go with their specific role in their communities in health equity. To do that, we engineer the fact that we need to have representatives for so many groups in the United States that we are very diverse and we are excellent professionals in public health who gave their life and experience in terms of health equities and their personal views about their interaction with legislation that intended to change equity, but in reality has not had the effect as necessary. That obviously created a new opportunity for public health professionals to think how legislation can be many times corrected, changed, or maybe expanded in order to have every group included in this progress that we want to have. The second position was a position that I held for 7 years, and I was appointed by the Illinois Public Health Association into managing their initial health equity initiatives within a state and start to create models of intervention within the state. Look with unusual partners that we might use or invite to be part of this conversation, but also to be part of the link and the community engagement that we need to do in order to improve our effect and reach of many of the interventions that we like to implement across especially rural areas and more disengaged areas of the United States. To accomplish that, certainly we look into many professionals that have immigrated into the United States, and many times they're taking many other roles within our society. So to give them an opportunity to reconstruct themselves in their original expertise and value and serve their own communities and start to talk with us regarding which are those nuances within their culture that will facilitate their risk, their elimination of risk, or learning about how those risks impact their health. Certainly, we couldn't ignore the fact of the immigration coming through our continent, Latin America, and how those systems many times have failed to bring the original history, clinical history of our immigrants, improving that consciousness and education regarding how to utilize their past in the medical encounters, as well as to adopt new services and the inclusion in many of the services that we have multiplied through private or government-based models in Medicare, Medicaid, and other systems.
Thank you for your work on health equity. Can you also share about your role as the Executive Director of Salud Latina?
I think that Salud Latina was one of the many initiatives that the Center for Disease Control has benefited many communities in the United States. And going into communities has been very important, especially for a government institution that started to make decisions regarding evidence-based practices. The recognition of these practices is extremely important because we have the feedback from communities as well as the participation of science-based interventionists that they can really massage and a little shape those interventions in such a way that we can conduct evaluation as well to understand better how to magnify those models into a larger population. So during that period of time, in reality, the Salud Latina was a pioneer in utilizing these conversations that we are having today, more than 30 years ago, and creating a network of discussions between many organizations in the Midwest, 7 states of the Midwest, and additionally to that, and recognizing also in the Midwest how different is the reality of each one of the states and how different are the resources that we have in each one of these states, multiplying new services, assisting the health departments in their development, and also creating communication systems between what we do in our communities and what providers should know and have as a continuum of service. So it's a very powerful intervention that has been still prevails in the utilization of chronic disease interventions, as well as in research too, recognizing how the intervention of partners, influencers, as we call them today, or opinion leaders, as we call them today, influence our decisions regarding economic distribution of many of the interventions that we have, including vaccination, let's say, as well as the intervention of those elements that tell our ear, in reality, how to say yes and how to say no to some of the interventions. The organization produced a newsletter too that was a big instrument of communication. Through the more than 25 years of life of the organization, many of these interventions still are used and still recognized as applicable to new concepts in healthcare.
Thank you. A very important intervention. Please share your experience as a member of the Men's Health Caucus.
Well, it seems probably it's very unusual that the person that has it so much involved with maternal and child health, and certainly looking into how women can be empowered in their own health care, as well as into many other decisions regarding the future of their life. A person like me would be interested in men. Certainly, it's very interesting to look into the fact that the road to health that was designed by WHO more than 40 years ago, probably, has truly created a lot of awareness between women regarding when to start their care, when to touch the public health systems as well as the clinical systems, the majority of the times associated with their reproductive health, versus men that there is no point to start their care. That's one of the many problems. Certainly, the other problem is the own construction of power and control that men have, and that is built by their reassurance that we give in a society. And that certainly impairs their ability to recognize their vulnerabilities and weaknesses and go back for help when it's necessary. So having a conversation and having a research on those aspects has been extremely important. Meeting with groups of men that would like to have a reflection and a better understanding why they are so relatively young age, are so deteriorated many times, or involved in any of the chronic diseases that really prevail in the United States, has been very important to recognize that as points of entry in their health care.
Thank you for sharing. Now, are there any special goals or initiatives related to public health that you're looking forward to in this year's American Public Health Association annual meeting in Minneapolis, Minnesota on October 27?
Well, I think that we have many goals. Some of them goals are go back into the COVID experience and what has happened with COVID, and where were still our gaps to engage the proper populations in a way, in such a way that it was the proper consent and the proper protection. Avoiding that mortality rates that we had certainly is a key point in this conversation. And the fact that COVID is a condition that is going to be repeatedly in our lives, sometimes in a more aggressive, sometimes in a less aggressive way, Still, we have a lot of work to do regarding chronic disease education and prevention. We can say, especially diabetes and obesity, that is rampant in all the population. Still, we need to look into the inclusion of many of the subgroups that are immigrating into the United States, and we know very little about how to intervene with them. We have had a significant amount of aboriginals from Latin America coming into the United States, and we don't want to repeat a cycle of invasion of our culture, but how we can blend interventions that have protected these populations as well as interventions that are proven to be successful in the United States. Those are among many issues. I think also that the issue of women's health is not only bounded by reproductive health, but at the same time, we need to look into many other variables that are impacting women's quality of life at this point. So the inclusion of those elements is extremely important for women to maintain their health and to certainly progress in recognizing where are the risks that we have avoided.
Thank you. Dr. Patricia Canessa, really appreciate your time and willingness to share with us your experiences and expertise. And we wish you much success in the upcoming APHA annual meeting. Thank you.